Hello, folks. My name is Dr. Vibhore Singhal. I am Senior Consultant Orthopedic Surgeon in Venkateshwar Hospital. Recently, we had a gentleman, a 97-year-old gentleman, Mr. Amit Singh Bakshi, yes, and he had a terrible fall and a terrible accident involving the left thigh. The thigh broke from a very precarious position, which is basically below the hip implant, which was already implanted few years back, and that makes the fracture very complex because fixing the implant or fixing the bone over that implant requires a lot of technical know-how, and technical difficulties are there in operating. And second, because of the age, because of renal condition, because of neurological condition, his surgery was a little complex. But I was very heartened to know that he is the one who represented India in 1957 Olympics. It was a World Cup. It was 1957 World Cup of hockey, and recently we had our hockey World Cup in India also, and he represented India and won a gold medal for us, and that was a moment of joy and moment of pride and moment of responsibility also within me to fix the fracture and make him walk again, because you can imagine how an active person throughout his life, he's been a pilot and he's done wonders for the country, and it became my responsibility to fix him and make him walk again, which we did, and I'm happy to share it with everybody that such a old and precious person can regain his functionality with modern techniques. Now we have our his son, Mr. Vikram, over here. Um, he will tell us about his journey throughout these years. I've known very good things about him. I recently knew that he was a Air India pilot also, right, and he was in Air Force, yeah, and he was a very fit person. And that's where I said that it's an inspiring journey. Okay. So I really wanted you to say something so that our youth can take an inspiration from it. We can take an inspiration from it, and together we can make India a better place.
Certainly. Well, first of all, Doctor, thank you so much we're really very grateful to you and your entire team for having done such a wonderful job with Dad's surgery and following up, so that's just been a pleasure dealing with the entire orthopedic team out here at the hospital. So coming to Dad's story, he has been an ex-Air Force person and a sports person prior to that, both an Olympian and an Asian gold medal winner in 56 Olympics for field hockey for India. And over the years, he's always maintained his active spirit and involvement, been a highly active person, being an ex-sports person and Air Force background. So just as age has caught up, injuries have become a little more prevalent, and the most recent one unfortunately involved a pretty bad break of the leg. So that brought us into our Venkateshwar hospital and meeting the orthopedic team here. So it appeared the doctor undertook this operation without too much fretting, I would say. He evaluated everything very well, explained the entire procedure, how he was going to move forward. And, so coming from my perspective, I personally developed a very good rapport and bond with the doctor because not only is the doctor I found to be technically very proficient, but he has displayed an incredible empathy and a connection with the patient, which is not always the case with all doctors. It's very important to develop that rapport and bond of trust. So I've been very fortunate that we've had a super good orthopedic team leading up the operation and the follow-up with Dad for his recovery. And I think he's going to do well and pull out of this by the time doctor releases him. I think things will go pretty well. Yeah.
Yeah, I think the surgery is gone without any complication. He had a pacemaker also, and that was
Yes.
also one of the challenges because pacemaker, the heart is also not working
Yeah.
fine. There are some challenges with that also. Plus his neurological condition where he was not following commands before the surgery. So all these things, all said and done, the complications has not been there, and I think we are going to make him walk today, and let's see the results.
Yeah, I'm looking forward to that too, doctor.
Yeah, let's do that.
Yeah.
From my side, he's absolutely fit.
Sure.
His wound is fine.
Right.
There's no swelling in the legs.
Right.
We made her sit, wriggle his toes, and moved his ankle and knee. And whenever he's fit or whenever he feels like, I think we can make him walk, and let's
Right.
do that.